Good afternoon. Once again, we're here on Facebook Live, coming to you from Henry Mayo Newhall Hospital here in Santa Clarita. Thank you for joining us today. And today we have joining us once again is Dr. Chiang, Dr. Tom Chiang, who is our head of infection control and prevention here at the hospital. He is an infectious disease specialist here, practicing physician, and he will be addressing some questions that have come in regarding the virus, as well as giving some opinion about the current state in terms of where we are with COVID-19. As many of you are aware, we've seen in many states a surge in COVID cases across the country. Here in the state of California, we've seen quite a spike in cases, and as a result, we've seen some scaling back of businesses that had previously been opened in what was called Phase 3, and as a result, we have a number of facilities throughout the community that are closed. One such is our Fitness and Health Center here at Henry Mayo. Unfortunately falls under the category of a gym, and therefore that facility is temporarily closed at this time. However, do note that the gym was open for a period of time. We had very strict infection control procedures in place. The members that did come to the gym expressed that they were very pleased with what they saw in the way of safety. Patients were wearing masks, etc. Not patients per se, they are fitness members. So with that, as soon as that opportunity avails itself again, we'll be reopening, and we have everything in place to keep you safe in that regard. All of our other facilities here at the hospital continue to be open. Outpatient clinics, outpatient surgery, emergency department is always available to you in terms of any of the even non-COVID related issues. Remember, there are many more conditions or medical emergencies that come up for people that they need to seek emergency medical care for. And we encourage you to not delay. If you have a medical emergency, to please come to the emergency room in a timely way so you can reduce the risk of a worsening outcome. So with that, welcoming Dr. Chiang here, and our first question, Dr. Chiang, is related to there's been a noted a number of rising of cases throughout the community and a higher level of hospitalization. Why do you think that is?
We opened up the economy, so now more people are exposed to each other, and I don't think everybody follow the three things we have to follow, which is personal protection equipment, social distancing, and washing of hands. And those are the three things that's been recommended since the beginning. But when you open up the economy and people are within closer proximity of each other, especially in an indoor space, you're going to transmit the disease. And we also test more now, so we're going to catch more positives. But as we see, most of the positives are in younger patients now. The first wave, unfortunately, killed off a lot of the elderly. And the second wave is more younger people who went back after the economy opened. So they don't get as sick, but if you have a lot more people testing positive, you're going to have a lot more hospitalizations as a result. So that's what we're seeing at this point.
Dr. Chiang, could you speak about the development of vaccines for a virus such as COVID-19? What might we anticipate in terms of how long that might take? What is that process like? We hear a number of researchers are working on it, but don't always have a good idea of like what's realistic, or how does this come about?
Well, there are hundreds of vaccines in development. The first thing they want to do is to make sure they're safe, and then they're going to test it in humans, obviously, and see if it generates antibodies. Just because the vaccine generates antibodies to the SARS-CoV-2 virus doesn't mean it's effective. So I think everybody is rushing for vaccines and treatment. These trials usually take years to pan out to see if they're effective, but with all the panic we have, I think a lot of these development of vaccines and treatments are fast-tracked. I really don't think we'll see any kind of conclusive data on how effective it is until this pandemic is actually over, which is probably around 2 years, my guess, until we get herd immunity. So I still think the safest way to go about is not to depend on the vaccine, but rather the three things we should be doing is personal protective equipment, social distancing, and hand washing.
So Dr. Chiang, in that regard, the social distancing, hand washing, wearing a mask, you think that that is been the most effective way to curb in some areas where they have seen decline? For example, in New York, where we all thought, oh my goodness, they're gonna really take a big hit, which they did, but it did not continue at the same magnitude is what we're seeing in areas now that are actually seeming to be worse off than New York.
Oh yeah, New York. Well, what happened in New York is they have twice as much immunity as the rest of the country because of that initial surge that killed off, tens of thousands of New Yorkers, unfortunately. So they're not doing anything different than the rest of the country, give or take. It's just that in some parts of Queens, like Corona, Queens, when they did the antibody test, 50% of the community already got exposed to SARS-CoV-2 already. So they have herd immunity. So New York City is probably the safest place in the United States at this moment. Everybody else is still running probably half as much in terms of immunity, and that's why there's more positives in Florida and Arizona and so forth until we get herd immunity, which is about 50 to 60% of the population. So for everybody out there, you want to be the 50% that don't catch COVID by the end of this pandemic.
Right, so what I hear you saying too, there's probably a lot more folks that have actually contracted the virus than even what we know about because they haven't been tested.
That is correct, and also CDC just published out a blurb saying that they figure about 40% of the people who caught COVID are asymptomatic. So that's why we have to be very careful with masks, because this mask is not to protect you from catching COVID, it's protecting you from protecting somebody else from catching COVID from you. So that's the whole point. If you have COVID, you're asymptomatic. If you wear this mask, you're probably going to filter out 50% of the of the virus before it leaves your mouth. Thank God. After it passes the mask, so you're protecting the public, and that's where these masks come in.
Right, I see. In that regard, I'd like to point out that the community here in which we serve here in Santa Clarita, we've had really good compliance with individuals adhering to the social distancing recommendation, wearing masks, and hand washing, of course. As a result of that, at our hospital, we're seeing a slower rate of added hospitalizations. We haven't seen recently patients be as critical when they do get admitted to the hospital, whereas in other parts of the state there have been huge surges. We've seen hospitals that are overloaded, their ICUs are, that sort of thing. So in that regard, I really encourage the community to continue to do those things they've been doing in that regard, because it has made a difference, and hopefully we're not going to see those huge surges of really sick people coming in. In regards to testing, we've had some questions regarding where can individuals get testing. Some of the testing sites have been becoming increasingly overloaded. As a result, some of the laboratories are running up to a week plus in terms of being able to turn around the results to patients again. We saw that initially when the testing first started to ramp up, and now again we're seeing quite a long delay. There are various public sites available throughout Los Angeles County where you can be tested. At our medical emergency room, we do provide testing, but it's a misnomer that people coming to the emergency room will get a faster test result of sort. That is not the case per se. Our tests do go to a laboratory. They go into a queue for review. Patients that are being hospitalized, of course, have a bit more of a priority because we need to know more immediately if they are positive, and we can place them in the appropriate unit timely, that sort of thing. In addition to that, there is an urgent care clinic here on the campus of Henry Mayo, and that is another place where you can actually call in and get an appointment in order to have a specific time to come for a COVID test, and that in some cases will be more convenient, and you'll be able to plan your time in terms of what your wait might be like. Of course, emergency department visits are based on the criticality of the patients that present to our hospital. So no guarantee exactly what time your testing would be done if, for example, you came to the ED. So do consider some of those other sites for COVID-only testing. Of course, if there's a medical emergency, this is the place you want to come to, our emergency room. Dr. Chiang, we're coming to the close of our time today. Are there any last words you'd like to share with the audience in terms of how to ride out probably many more months and maybe even into years that we're going to have COVID-19 around and having to stay safe and take caution?
Yeah, so once again, I think we have probably a 2-year road with this pandemic. I don't see any exciting vaccines that will come out that will prove itself out before the end of the pandemic, or any treatments that is fully effective. So you want to be the 50% that don't catch COVID, and how you're going to do that is with PPE, social distancing, and hand hygiene. Those are the 3 things that have been proven to be effective to slowing down this disease. So, that's all I have to say.
Very good. Once again, thank you, Dr. Chiang, for joining the audience here, presenting on Facebook Live here from Henry Mayo Newhall Hospital. We would like to invite our audience to send additional questions to us that you might have, and we look forward to being with you again on next week. In the meantime, please be safe out there, wear those masks, social distance, and hand hygiene. Keep those hands clean. Thank you very much, and we'll see you next time.